Sabine and Themba, welcome to this conversation and thanks for joining me. We are seeing an increase of health risks around the world despite increased scientific knowledge and evidence. How the UN in Georgia and Samoa helping to leverage the progress and strengthen health system? Mm-hmm. Yes, Sabine.
Thank you very much, Igor. Well, WHO had actually done a study back in 2021 when they looked at some of the data, and until 2018, falling into poverty was one of the issues for people who actually had to pay a lot of money for the medicines. Yeah. So actually this access to medicines and also getting treatment in hospitals was very, very expensive and was a real problem for many of the families. So we as the UN family in Georgia decided to partner with the governments and to see how we can support a change in this situation. And actually the government made very important reforms based on the recommendations of WHO, the World Health Organization, where they have actually gotten rid of these surprise bills from hospitals. And they have also made a sort of a reference price list for medication. And this has helped the entire population, including, of course, also the most vulnerable that are very much concerned to us as the UN in Georgia. And in particular, one issue, the people also with disabilities, that they can get access to healthcare and to quality healthcare. So I think this was a very important way forward, also towards this universal health coverage. Obviously, it's really important that this has been done. And since the changes have been made, I think there's also already 500,000 cases or so that actually received also state funding for the different treatments that they have in the hospital.
Yeah, great. Yeah, Themba, please.
No, thanks. Health challenges are a big priority for the Pacific. And in the 2050 strategy for the Blue Pacific continent, which is a continent-wide strategy, the Pacific leaders have recognized the importance of health. And in Samoa, where I'm serving, this is also a priority of the government. It's articulated in the National Development Plan, which is called the Pathway of Samoa's Development, and there's a health sector plan. And we have seen in the recent years improvements in universal health coverage. It was sitting around 43% in the year 2000. In 2019, it was at about 53%. We have seen improvements in the maternal mortality rates, infant mortality rates. But there's one issue that I would like to put a particular spotlight on, and that is the issue of non-communicable diseases, which is a huge, huge challenge in Samoa. Just to give you an idea, about 90% of the population is considered overweight. An estimated 63% is estimated to be obese. 35% of the population has type 2 diabetes. And the Prime Minister recently at the General Assembly, in her statement, she mentioned that over 50% of all the deaths in Samoa are attributed to NCDs. So this is something that as a United Nations, we are trying to support the government. And I would like to share a few examples of the progress that we have registered. So under the leadership of WHO, for instance, there's been some remarkable reforms in the legislative area. For example, the ratification of the WHO's Framework Convention on Tobacco Control, placing restrictions on the sale or marketing of unhealthy food and alcohol to children. We have seen FAO, for instance, providing a lot of support in ensuring that there is production and consumption of fresh, safe, nutritious food. Our colleagues in UNICEF have done a lot of work in reviewing nutrition policies, and UNFPA has come at this from the reproductive health and rights perspective, issues of cervical cancer, looking at strategies and policies on the elimination of cervical cancer, for instance. And of course, as an RC, my role there and the role of the resident coordinator's office has been to ensure that the analytics is very strong so that these priorities are embedded in our programming instruments.
Yeah, gorgeous. Please tell me, what are the lessons learned following the COVID-19 pandemic in your countries, and what innovations the UN country teams supported? So maybe start from you.
So I think one thing that COVID pandemic showed us is the interconnectedness of the issues. Because the pandemic was not just a health emergency, it affected so many other sectors of the society. As we speak, just a week or so ago, Samoa hosted a joint external evaluation by WHO, and it's the first country in the South Pacific to conduct a joint external evaluation. As you know, there is an increasing complexity and impact of health emergencies in the Pacific, and this exercise was led by WHO but had the participation of different sectors. It was owned and led by the government. And what we are doing in particular, also coming back to the issue of NCDs, is that leading up to the SDG summit, the Resident Coordinator's Office provided support to the government to conduct national consultations, to look at the progress that has been made, but also what is outstanding. And certainly the issues of non-communicable diseases came up as a big issue. And what we are doing now from the UN is leveraging our convening role is to explore with government how we can convene multi-stakeholder dialogues to define the problem and how we can address it from a systems point of view. Because there are economic factors, there are social issues, there are perhaps traditional, cultural issues that we need to take into account. So a whole of a society, whole of a government approach, and this is what the government of Samoa is also trying to promote, one health approach. And the UN system is really behind them to support them in this regard.
Yep. Thank you. Yeah. So what about Georgia?
Yes, I think also very much like, Samoa, I think this one government and one society approach is extremely important. One of the lessons that we have learned through COVID was also this interconnectedness, as was already mentioned. But we had 4 agencies that came together, also under WHO, World Health Organization's leadership. Also UNOPS is a participant, UNICEF is participating, and UNFPA. And it's a project that is financed by the European Union, nearly $5 million. And I was very much involved as the RC also in negotiating this, a very interesting program because it's about telemedicine and digital health. So we are really going out to all the remote areas, to the mountainous regions, to the rural areas. 200 different places have already received some very basic equipment, and about 50 distant rural areas have received already the telemedicine equipment. The idea is that people have access to healthcare where they are, and also to train the rural doctors through that. So these 4 agencies have actually come together and have put really a very important program into place, I think, which is exactly in the spirit of what we are doing as the UN family, really leaving no one behind, no matter where people are, also in these very far away areas and where it's difficult usually to be transported to a hospital and so on. So I think these are the areas that we want to continue, and we also believe that these are the areas, where we are very happy that our host country is really interested in learning from this, and also the whole fallout from the COVID pandemic and how we can actually address those.
Yep. Appreciate your time, your answers, and wish you and your team's success in the future. And thank you very much.
Thank you very much.
Thank you very much.